thank you all for joining us as we get started today. And welcome. I'm here at the National Genetics Education and Family Support Center. My name is Molly Martsky. I'm the Senior Program Manager of this project. And today I am joined by a couple of individuals, and we're going to talk about implicit bias and really identifying it, addressing it, reducing its impact, what it sort of means in this healthcare field to families, as well as those providers and professionals. So first off, I just wanted to say a little bit about, I said the big long name, but we call it the Family Center. And so the Family Center is supported by HRSA. And this is our disclaimer, just to let you again know that we're thankful for our partners at HRSA who allow us to do this work and really talk about that family engagement and leadership and what that means in systems of care. So yeah, we love the Family Center. Today, I am joined with Louise Rollins as well as Amanda Lawrence. So thank you both very much. I will let both of them introduce themselves in a minute, but I just wanted to give you guys just a little bit of a heads up about myself, how we got talking about this idea of a webinar around implicit bias and stuff like that. So I'm going to stop sharing my screen because we really don't have slides for today. It's more, again, this conversation. So I invite you to, as we go through this presentation, if you have questions or you want to, ask us anything or follow up, please put them in the chat. We have saved about 5 or 10 minutes towards the end, so to make sure that we can really get to those questions, because a lot of this understanding I have found really comes through this idea of conversations. It's this different thoughts, getting us to think about things a little bit differently. So like I said, please put your questions or comments that you might have in the chat. We'd love to get to them. Now, again, about how this webinar got to be involved. So the Family Center really supports work around family engagement in genetic services. And how that impacts families and in really that system of care. And so as one of the activities that we do here at the Family Center is we have a work group on inclusion that meets monthly. It's a group of individuals who are really dedicated to ensuring that more than just diversity equity happens, but it's really that inclusion piece. That's where the name of the work group came from, is because they really are adamant and passionate about that idea of inclusion. So we get to have lots of conversations during that meeting every month. And then what happens is there's ideas of things that they either want to produce or have conversations about. So we did a webinar on family engagement and what that means in genetic services last month. And so this month, we are really looking at this idea of implicit bias. And so what does that mean? What does that look like for individuals who are interacting in that healthcare space? So that, again, is a little bit about the work group on inclusion, why this topic was important to them. And then I am going to turn it over to Louise to let her introduce herself, talk a little bit about, how she came to this work and stuff like that. So Louise, thank you.
Hi, hello. I'll apologize first. I do have a lingering cough from a almost 4-week-old cold, so that'll interfere as it wants to. My name is Louise Rollins. I live outside of Baltimore, Maryland. I work as an early intervention teacher of the deaf. So that's special education for children who are not yet school age, so birth to about 3. And so I work in a county that is a suburb of Washington, D.C. that has tremendous income disparity. We have great affluence in our community and a lot of very under-resourced communities as well. And so, with the diversity of families that I work with, and previously I worked for the State School for the Deaf here in Maryland, serving about 13 different counties and districts. So working with such diverse families and also diverse colleagues, to me, it's it's obvious, right? That we all have our own automatic thoughts and beliefs and assumptions about people, and it's our job as professionals or as stakeholders in the system to get rid of the bias and get rid of the stereotype to the extent that we're able to. And so that's what brought me to be curious about delving more into implicit bias and investigating it in myself, and then bringing that to my colleagues as well. And I should also say my parents are deaf, so I'm a stakeholder in that way too, a family member of individuals with disabilities. So I sort of have the professional side and the personal side as well.
Yeah, absolutely. And I think that's great points, Louise. I think a lot of us bring many of those different perspectives to this work. And so then it allows us sometimes to see it when maybe we didn't know that it was sort of there in this idea of topic. So I'm looking forward to diving into it a little bit more with you. And so Amanda, welcome. Why don't you tell us a little bit about yourself and how you came to this work?
Hi, I'm Amanda Lawrence. I am the mother currently of a 27-year-old with a slew of diagnoses, but many years ago, I was seeking out support and I became involved with a support group. And at that point, I started learning that he was undiagnosed through no fault of my own. I was very diligent, even as a young mother, had taken him to many specialists over the years, and just became very involved with the Cumberland Salem Gloucester Family Support Organization, and learned to navigate the children's system of care, facilitate the parent group, and currently the vice president of the board there. And just my involvement, having to learn those things. Unfortunately, my son, didn't get diagnosed even with autism until he was 20. So, the bias is a very real thing in my life. And so right now I try to help other families as best I can. Like I said, just by learning the children's system of care and learning to navigate it the best I can. So that's where I'm at.
Great. Well, thanks again, Amanda. And I'm sure everyone, again, is excited to learn a little bit more about this topic. So I think we'll just kick it off around this idea of implicit bias, right? So again, I know we have probably people that are on this that maybe know a little bit about it, but then we also have those who might not know about it at all. And so I thought I would just start. I'll talk just a teeny bit about when I think of implicit bias. And then again, I know, Louise, you've done a lot of work in this sort of area and stuff like that. And so I think, and Amanda as well, and we'll kind of talk about what does implicit bias mean to you, and maybe even sometimes how it shows up, right? So I think at that very fundamental level, implicit bias is really just that when someone says something and an image pops into your head, and it's not even that it might be a negative one, it might just be an image, right? So if I said kindergarten teacher, a lot of times people think a young female, and that's what a kindergarten teacher looks like. So it's really that just sort of, it's not always negative, but it is that bias that then sort of influences maybe what we think or how we interact or decisions that were made. So again, I'm going to turn it over to both of you as far as that idea of, what does implicit bias mean to you, and how do you think about that as well? So Louise, maybe, or do you want to kick us off with that?
Sure, I don't mind. In preparing for this, I did a little bit of searching on different definitions, like what are the official definitions, and there isn't one, right? Because it's still a relatively new topic that we're having lots of important conversations around. But the word implicit is a little jargony, right? And another way to talk about it is just unconscious bias. And I think that's a very plain language, very mutually intelligible kind of term, or you can interchange the two terms. And it's just, preconceived notions I have about other people that belong to different groups that I don't realize, it doesn't come to my mind. I don't like this person because they are fill in the blank category. But it's something about my prior experiences, images I've been exposed to in the media, other, beliefs that have been taught to me through family members and through society, the way I've been socialized, that create, those categories in my head. And this person fits in or doesn't fit in, and that can be good sometimes, and often it's bad because we're making an assumption about the category instead of the individual. And I think that's where the first step of harm comes in.
Did you have something you wanted to add, Amanda? Otherwise, I was going to.
Yeah, and like you had mentioned earlier, sometimes it's not even a negative thing necessarily. It's even just, someone might say, a doctor such and such, and people will still go, oh, it must be a man, something like that. And unfortunately, in the medical field, it's the same, thing. From my personal experience, I was like I said, a young mother. I was 17 when I had my son, and things that we know now. Can you hear me okay? Okay. Things that we know now, back then, I don't think that, it wasn't as commonly diagnosed, things like autism. And we might say, okay, young mother doesn't know about nutrition. And so her child is eating Pop-Tarts and ramen noodles and not indulging into the fact that there was texture issues and that he would not eat anything other than those things, and looking and going, maybe that this is, this has to do with sensory, things of that nature. So, unfortunately now it's getting a little bit better, but, things like race, social status, how much money, if you're economically not, rich, or, any of those, your social status, or again, I was a young mother, my son was biracial. He was also very big for his age, so he looked a lot older than what he was. All those things took place, and it continues to go on to this day. Not really, like you said, as a negative thing. They're not looking at you going, oh, this is who you are, but it just happens.
Exactly. And again, so, you talked about a young mother, right? So sometimes as we pursue those ideas of diagnosis, it might not have been even bad, but it was this idea of like, oh, she's just learning how to parent, or she just doesn't quite, it puts those ideas or those thoughts, and maybe they're not even at that forefront. It's that unconscious of like, oh, well, we know younger parents might traditionally need. And so it's not looking at that individual, but it's looking at that as a group, as a whole. And then that's where that danger kind of lies, about that bias getting in the way of potentially diagnosis and all of that. So we talked a little bit about how does it impact families, or, how does it impact patients? How does it impact those that are in the school district trying to access services and stuff like that? I thought maybe you guys could touch on that just a teeny bit. So.
Go ahead, Louise, you want to
go? Okay, sure. I think Amanda couldn't have given a more clear example that, even when it comes from a place of compassion and, maybe we need to educate this young mother, maybe we need to get curious and learn about this individual family and their individual circumstances, and rather than making assumptions, and maybe we could make some educated guesses, but then our next job, especially from my perspective as the professional, my next responsibility is to get curious and kind of interrogate my assumptions and see whether they're correct. Because otherwise we're just dismissing families out of hand. And, what we know, I'm not an academic, I'm not a researcher, I'm a kind of boots on the ground, like in families' living rooms kind of professional, but I do know that there is a lot of data out there about especially families of color and their interactions with especially the medical establishment and their their comfort level, their willingness to reach out to seek care, but also the care that they receive back from those professionals, even from a diverse group of professionals, although we know our medical professionals could be a more diverse group, right? But we know that our families of color aren't receiving the same standard of care as our white families are. And that's going both ways, right? It's coming from the care they're offered and also the trust they can invest in the system. And we have to do better by our children. We have to.
I love to give this example. When Elijah was in 7th grade, the child study team psychiatrist had told me that Elijah felt he had no control over his life because I had been married twice by then and had 3 other children, and basically insinuated that, that was what the issue was. And so Elijah was in the room, and I said to him, Elijah, is that true? Do you feel like you have no control or no say in anything? And he said, yeah. He's very serious. He said, yes. And I said, well, honey, what is it? Because I knew where the woman was going with it. And I said, what do you feel like you have no control over? And he said, you won't let me wear eyeliner or black nail polish to school. And I just looked at the woman and I was like, this is what it really is about, And so again, it was just this like judgment of, no, and there's plenty of educators and people who do want to do their job and get to the bottom of it and help families. In these circumstances, this was a fight, a battle. And it was like, you just don't want to give him the services that he needs. And you're trying to blame it on my personal life. And it has nothing to do with it. That, this is a kid who needs services. He doesn't care that I've been remarried or he has another sibling, So it's just something that continues to go on. And, we had to learn to fight and with the medical field and the education system to advocate and give our children what they need.
Yeah, I think that's a great point. And Louise, I just want to back up a little bit to something that you had mentioned about how implicit bias really goes both ways, about how, again, so there's maybe a lack of trust in the system and again, for legitimate reasons and all of that. So I'm not discounting that or putting that burden back on families, but it is a reality, right? So it's a barrier to services for families. So maybe talk just a teeny bit more about that or elaborate on that. Again, I think a lot of this is part of that conversation about it being both ways, right? That we all have these implicit biases. And it's really that recognizing it in ourselves. And so again, if you could just elaborate on that.
Yeah, I do think, and thank you for clarifying, Molly, that the bias that comes from the families is from experience, right? Whether that's their personal experience or their family, intergenerational trauma about care they received from the educational and the medical systems. It's not for nothing. And that's why these biases are so so sticky, so insidious, and so hard to get rid of, because they're not made up. They come from, at least in part, they come from truth, but they're not universally true. And that's why it's a problem. I don't know about, sort of the makeup of the audience here, but as a professional, I would say when families have trouble trusting us, the work still falls on us to fix that, right? It's not to say, well, the families have to investigate their implicit biases, because they come from, if not me personally, from the system in which I work. And so it's up to me to maybe reach out, a little more often, a little stronger, a little harder, a little more warmly to make these families feel like, if not, they can trust the whole system, they can trust me, and I can open that door for them. So I wouldn't, like you said, Molly, I wouldn't, put the responsibility on the family, but on the professionals in the situation personally.
Yeah, no, I think that's excellent. That's exactly where I wanted to go. Because again, it's a mixed crowd. So we do have professional, we have families who are working in the system to do that sort of system change. But it really is, again, how do we address that and how do we recognize that and then work towards it? And I agree with you that it's not because of there isn't that foundation for that reason, for, that lack of trust and that potential bias against a system, that, it's definitely there, but where do we go to then help repair that? Okay, so we talked.
Reading the message. I was
Yeah.
reading messages.
So, yeah, so there is a couple in the chat. And so one of the individuals here talked about, do you have any tips how we can fix our biases? How can we have conversations that we need to be having without placing the burden on those that are facing that bias? So, I know we talked about this a little bit in the beginning about sort of that self-evaluation around our own implicit bias, and I'm not sure which one of you talked about like that's where some of the work even started, like your curiosity about this idea. So I don't know which one of you would like to maybe address that or talk a little bit about it.
It's some of my families, with minority families, and I dealt with this myself with my son's father's family. It was very difficult with my son's grandmother for her to even accept any of his diagnoses and to get her on board. Like when she would have him, she would refuse to medicate him, and then would punish him though when he would do things, off of his impulses and stuff. And it took years of me trying to work with her, and finally she ended up getting custody of his younger brother from another mother, and he had a lot of the same diagnoses, the same things going on. And she finally came to me years later and said, explain to me a little bit more about some of his diagnoses. So I think that you don't want to. And it's also very big in the Latino community as well. It's almost like, especially the men, like fathers, seems to have a lot of pride. And you're not going to say that, there's nothing wrong with my child. And there's not anything wrong. It's that there's something different going on. That's where the expression I love to say, differently able, So I think just education and trying to educate everyone, and that includes medical staff and teachers. It's not just the families. I think just trying to make sure everyone is educated and has an understanding of what different genetic disorders are, what different diagnoses are, and then also what is lacking in our communities as far as, even right now, what we're dealing with from DuPont and CHOP not accepting, Medicaid anymore. Our children's hospitals, like this is going to be a humongous burden for our families. What specialists are they going to take their children to now? So it's a very big, it's a big burden. It's a big, thing that we're going to have to get through and work together. But I think educating everyone involved, the best that we can, is one of the biggest hurdles that we're going to have to get through. That's my opinion.
Yeah, so the question, as I understand it, is how can we fix our own biases, and then how can we sort of reach out to our little sphere of influence and have those conversations rather than making the family be the one to prove that they are not, XYZ stereotype. And so, the work that I've done for myself is a lot about just noticing, just hearing the voice in my head that says, this person does X because Y, and it could be as simple as like I'm out in traffic and somebody does something, unsafe or impolite, and I want to see what that person looks like. Well, why do I want to see what that person looks like? What will that tell me about why they're an unsafe driver? And whose voice is that in my head? So step one is just hear it, right? And then step two is, it's a lot of mantras that I take from my own like personal therapy sessions. I am not my thoughts. So just because I thought it, do I believe that? Do I really believe that? And no, I don't. I don't believe that person's a bad driver because they are, a member of whatever group. But then where did that come from? Where did that come from? If it's in my head, it's somewhere, deep in my subconscious. It's that unconscious bias. Where did it come from? Is it, my God love him, my racist uncle, you know, is it TV? Is it socialization? Is it, you know, where did that come from? And then, you know, it's like, sometimes they'll say like sunlight is the best disinfectant. I can't, I can't I can't repress it and expect it to go away. I've got to rip it open and go, I don't believe that. And that's not helping me. And that's not helping that person or that group of people. And then you know, the next step, going out into your, you know, little circle of influence, which might not be everybody in your system, but it might be your families that you support, your patients that you see, you know, your colleagues. It takes really brave conversations that can be brave in a split second. So, you know, I have a colleague that is a wonderful example for me, because she'll call me out when I say something impolite or inappropriate. And she does it in, you know, it takes, I'm sure, a moment of her deciding, am I going to call Louise out on this in this moment or not? And she does it, and she does it with care. And she'll remind me, like one time I said, oh, I'm sorry, I don't know why this person is taking so long on the computer. You know, she really should be done by now. And she said, maybe so, but remember that English is her third language, and she's reading right now. She's reading in English. She didn't have to call me out. She didn't have to, you know, tear me down. You know, not to say there might not be places and times when you want to do that or when you might think that's appropriate, but just connecting me with the facts of the case brings me back to, aha, I have to stay out of judgment. I have to remember, you know, the individual that I'm dealing with here. And so I've tried to take that as an example, pardon me, in my team meetings when, you know, colleagues might say something about a family. And a lot of times it's, I don't know why they don't just, you know, whatever it is, that individual, you know, that professional thinks the family should just do this, just do that, just do what I tell you, just follow the advice, just do the obvious thing, just do what the doctor said, whatever it is. You know, and so it takes a split second for me to decide, is this a time to be a good ally to this family? And then what are the family's values, or what are the barriers this family's facing? You know, just a curious question to get people's wheels turning. And then that puts them in that same place of, okay, get curious about it, you know, kind of bring it out in the sunlight. Where did it come from? Whose voice is that? And is it true? I hope that addressed the question.
Good point.
Yeah, no, absolutely. I think that addressed that in a very sort of great way that gave concrete examples of how you sort of see it. And again, I think it starts at that awareness level, right? So it really does that. Like, you do have to catch yourself, which is hard to do because you don't always, sometimes, again, that unconscious, you don't even always realize you did that. But as you reflect or as you think about something, but it's just even that you start to see how society itself sometimes like puts those views as you read a story and you're like, okay, why did they include that information, but not that information? Like, I just read this story about this situation, and then I read a story about almost identical, and like, what was included in that one versus what was included in this one really changes, you know, how you see. Or again, if things are used to describe somebody, you're like, okay, well, why did they use those words? And, you know, we've had a whole conversation about how words can create this bias towards families or this action around families. Again, a really good friend of mine and I talked about it and said, you know, like in mine, when we talked about genetics and whether we wanted to pursue testing, and we went through this whole family process and we decided, you know, not to do it. And in our notes, it was like, oh, family decided not to pursue genetic testing. But in hers, it was recommended. And she went through that same process in her family and she was labeled as non-compliant. And how those, and it might not have, you know, again, it very well could have been very deliberate to put non-compliant in that, but it also could have just been somebody's own bias that sneaks in, and that unconscious bias and writes non-compliant in somebody's report, and how that then sets that family up for that next interaction with a healthcare provider if they, again, choose because of their own values or what they feel like they need out of the healthcare system, and they chose not to do something, how that, you know, creates that bias towards them before they even walk in the door into that next appointment. All right, so I'm looking to see, so there's, you know, I think you talked a little bit about it, Louise, and you as well, Amanda. I think you alluded to it about this idea of conversations and sort of how that really then helps bring to this understanding of individuals and where they're at and stuff like that. So I I think it's this idea of coming back to that idea of like there are places to have these conversations. So it's definitely not always the place to have it with, maybe if you're a provider, with that individual family that you're serving as you're trying to investigate, you know, what your bias is around them, but that there is these places, again, part of the reason for this webinar to have families on this as well as providers is to say there are family leaders that are working in these systems of care that want to have these conversations and go, okay, this is how this impacts me. This is how we need to look at this system to help improve it so that it's better for all families. So have you found places like that, or family organizations or professional organizations, you know, that sort of have those conversations with to learn more?
What do you mean? Like just where you can
Yeah,
kind
so again, so if we have a professional on this that's saying, you know what, I really want to learn more about this family experience or what that's like and stuff like that, more from a systemic type of a viewpoint instead of like an individual. Again, I think some of that individual is as they notice how families are going through their system, they start to pull that out, but sort of this bigger conversation around bias within this healthcare field.
So for me personally, I mean, you know, I deal generally with just the FSO. You know, however, you know, I have dealt with DCP&P with, you know, in a more professional setting, you know, here and there. I have a more personal relationship with my families. So, you know, they don't have any issue coming to me, you know, calling me. We have a private page on our Facebook that is actually a secret page where no one could even find us. They have to, you know, be included in it to come to us for resources, for advice. But you know, just it's for me, it's just my relationship with my parents and families, you know, where they'll come to me and say, you know, this is the issue that we're having. And, you know, a lot of times just having someone there with them, whether it's at the doctor's office, in a courtroom, at a child study team meeting, you know, that's all that they need. But as far as I haven't really experienced too much of, you know, needing a different setting, I guess, you know, that's just personally, I don't know. But I mean, I guess for a professional person, that would be where they could seek something like that out, is to say, you know, that's like for us, a success center or a family support organization. You know, most of my families have said, that is where they get the most help from, you know, from their actual support group. So as opposed to, you know, different agencies and things of that nature. So I don't know if that really answers.
I too don't have a super answer to that question, because in my workplace in the last like maybe 3 to 5 years, as we've really tried to invest more professional development time into, you know, diversity, equity, and inclusion, to be perfectly honest, I felt like every time we have a speaker or a training, we start at square one every time. And personally, I get frustrated because this is a topic that I've done my own reading and my own work on to some degree. Not to say I'm done, not to say there's an endpoint at all, but I'm, you know, I feel like I'm at square one or two, not zero. But we have to, at the same time, especially when you're dealing with a big pool of stakeholders or a big system, everybody has different entry points and everybody's starting at a different place. And so we almost have, you know, we almost have to back up in order to get everybody to move along, you know, we can't leave people behind just because they are, you know, still in a place that I feel like, you know, when I was a child, it was big on you absolutely, it's unacceptable for you to say you dislike somebody because they are a different skin color than you, religion than you know, whatever. Like you don't say that. It's unacceptable. It's racist. It's discriminatory. Well, now we're in a different place, I think, in our conversations where it's, you know, I don't hate, you know, I don't hate them and I don't discriminate against them because of this category, but it might be because of some of their characteristics that are really tied into that category, you know, that group that they belong to. And that's where it gets, again, more insidious and harder to separate. You know, I don't like this person because of their skin color, but I do distrust them because of the way they display strong emotion, for example. And that's different than the culture I was raised in. And so that's uncomfortable for me. And that makes it hard for me to connect with them. You know, so we're all in very different places when we get away from just, I don't dislike them because of their skin color or their religion. And then along with that, I will say, I want to echo what was said in the chat here is that we need people with more diverse lived experiences in those, you know, at the table, making those decisions, deciding who else is on those committees, deciding who else is on those work groups, because that's the only way we're going to get, you know, more understanding of diversity, right? Is if we have more diversity in those spaces. And so, you know, if I have, you know, one South Asian colleague and I say, hey, I have this Pakistani family and I have a question about their culture and I really want to know. And she says, actually, I'm not Pakistani, I'm Indian, you know, or yes, I'm Pakistani, but I'm not from that part of the country. I'm not from that, you know, ethnic group. I'm not from that family, that individual family. You know, we have to refrain from making people sort of, you know, spokespeople for the entire group that they belong to. And so it's just going to take lots and lots and lots of up close experiences with colleagues who are diverse.
And something I learned, you know, because and I was a nobody. I'm not a professional, you know, and within very little time, I was, you know, facilitating support groups and getting awards for the most improved and the board president and making all these decisions and fundraising and doing all these things, going to kayak meetings. If you encourage your families who are having these issues, they want them at these tables. They want to hear their voices. They want to hear their opinions. So that's a way to get the diversity involved. You know, so if you have a family from a specific Asian culture, a specific, you know, Middle Eastern culture, anywhere, you know, you can encourage them, you know, please be the voice, you know, even if it's hard to do so, you know, it is very encouraged right now, at least I know within the children's system of care. You know, I don't know how much in the medical field, you know, but I know that, you know, that's a really good, you know, way to try to get the families involved so that there is more of a voice, you know, because they want to hear it. I'm always so welcomed as a parent, more as a parent at kayak meetings and things like that than as a professional. They're so excited to see me there in that capacity. So.
Yeah. So, I was just trying to read, there was a big comment. It was like, it was talking about this idea of assuming positive intent, right? When you come to that table, assuming that that individual, that parent in front of you is doing that their best and that they might just, you know, need knowledge not readily accessible to them, or that they have barriers such as language, transportation to work around. I think that trait opens up a lot more conversation and trust along that willingness to go to those tables. So that idea of assuming positive intent. Did you, either one of you want to respond to that?
Reading it.
Yeah.
I'd add to, I completely endorse that. And I'd add to that, assume, what's the term? There's a quote that I used to have on my office wall before my office moved, and it was basically like assume competence in your families. And so I love what Amanda's saying about you give that personal invitation. You know, you are a family member who has struggled with the system, and I believe in your ability to make waves and make change in this system, because so many of our families, they don't see themselves represented in those decision-making positions, and so they can't picture themselves there. Sometimes it takes somebody reaching out and saying, no, you can do this. You can, you can take on this responsibility and you can help the next generation of families.
And thank you, Jen, what Jen said.
And I love that, assuming competency. Again, I think some of the professionals that have touched my life, and, I'll go back to, my pediatrician saying, because I believe in you as a mom, that if you think something's wrong, I think something's wrong. And so we'll do this, right? So it's just assuming that and he would say it. And so even by saying those very words, made me feel more confident, right? More confident in what I was doing and what I was bringing up, what I was saying. So I love that idea of not only assuming that positive intent that I wanted to do well, but that I was also confident in my job. All right, so we have about 15 minutes left. I know we said we would leave like 5 or 10 minutes for any questions. So I'm going to ask if anybody in the group has a question that's in the audience. They certainly can type it out. I believe I'd have to ask Dr. Ebony because she's really in charge of this webinar and all the logistics, but I think you can unmute yourself and talk if you'd prefer to do that instead of asking a question. But yeah, we would love if anybody has any questions or any ideas or any thoughts about what has helped them as they have, examined their own bias and done some of their own work in this. So while we're waiting to see if anybody has anything, I don't know if either one of you wanted to add anything in these last few minutes that you felt like we didn't touch on, or that, again, I think you put it best, Louise, when you said that there really isn't an endpoint on this, right? Like it's a continual lifelong journey of us looking at ourselves and our biases. And as we work to minimize and decrease these in the systems and in these, systems that serve families, that we might get one thing, but we'll continue to work on them. So I see Mariana has her hand raised. So yes, Mariana, I'd love if you have a comment.
Hi, all. First and foremost, thank you both. Thank you, all of you, but particularly the panelists for just being vulnerable and transparent and sharing these perspectives and experiences. I know Molly said it earlier. For me personally, it really does just help to teach and learn kind of how to think about things differently. So just wanted to start with that. Thank you for doing that. You both mentioned kind of briefly at different times the role that media has played in shaping this conversation. And I'm just curious if either of you would be willing to kind of dig in a little bit more there of just, how do you think media really is playing a role in some of these unconscious biases, and what can we do about that? In your opinion, what are some suggestions to help just make sure that these conversations and narratives go in a positive direction and not continue to worsen because of the role that media plays? I know that's a big question, so any part of that, I welcome your thoughts.
Ooh, that's a hard one. Explain to me what you mean a little bit more. Just how just like social media, things like that play a part in.
Yeah, I think that, and what's been good experiences that you've had through media, and how can we kind of build on that? Because I feel like we hear so much about the negative component of social media and how it negatively impacts biases, but maybe if you've had a positive experience, what was that experience? And that will help us think about, okay, we can build on that.
I made a TikTok once that was about my son, again, he's 27 now, and he came to me once. His father had a girlfriend who I didn't care for because she just seemed shady to me. Like she would never look me in the eye, and she just seemed shifty to me. Like, you're taught growing up, you look someone in the eye when you're speaking to them, and that's how you can tell you're an honest person. And my son is an adult at this point. He comes to me and he goes, Mom, she's on the spectrum. And I just felt like crushed that I'm looking at this adult woman, and here I am, I have a son who's autistic, and all these years, even though, she did have some stuff going on with her, but that was one of my main things that kept me from giving her a chance was, and I had to call myself out, and I made a TikTok about it. And I was like, all these years, that should not have been what it was. Cause as a woman, I'm going, look, this woman won't even look me in my eyes when I'm talking to her, and that's what it was. She was on the spectrum, and she had a hard time looking me in the eyes. And I was like, shame on me. Like, what's wrong with me? So I felt like, that to me, was just, I had to call myself out on that and hopefully bring a little bit of awareness to other people. Something so simple that you wouldn't even think of, hey, check yourself, So I think Miss Sydney has her hand raised.
Yes. Can you hear me? Okay. Forgive me of any background noise. I'm in the hospital with my daughter, so that's why I stay muted most of the time. What I would say to the question about combating or defeating all of the negative images given through social media or the media, which I would say the news is probably the biggest one. We have to be very intentional about finding positive information and images. The information that comes to us easily, it's not, well, I don't want to say I distrust the media, but you have to be intentional, like on purpose, looking for reliable sources of information. And for me, the best way I've been able to find positive is to find it in the human experience. Go out of your way to make connections with a human being. That's one. And the other way is when I challenge myself, it's give the person the benefit of the doubt. Because it's just natural. Like our brains are wired. Negative experiences will stick. Negative memories will stick more than positive. So when I meet someone new, when I see a situation from afar off, the negative is going to pop up first, but I have to give rewind or pull it back and think, but what if it was this way? What if I didn't get all the information? What if the person was just innocently thinking something else? So those are the two things I do to challenge myself when it comes to bias. What if that person wasn't aware that it caused me to feel this way? What if? And then when opportunities come up for me to address or share information with somebody, I make sure my posture is that of sharing information and learning and not antagonistic. And that goes a long way for helping with the information exchange. But I will say you have to be intentional about finding out positive things to challenge, stereotypes, implicit bias that's fed to you or fed to us through social media. Stereotypical information is easy to push out there. I know as I became an adult and started in the workforce, I was surprised when I started to meet people of all, or better yet, go back to college before I got in the workforce. When I got to a dormitory and there were all cultures and, different genders, we had male and female in the same dorm, just separate bathrooms. You talk to students and then you're like, oh, and they're like, well, I always thought, because in my little town, we didn't have, XYZ, and just sharing the information. and seeing different. Well, oh, you're kind of cool, or oh, I didn't know it was done this way. Um, and a lot of times different isn't bad, it's just different. So that's what I would offer you in the age of social media. Go be intentional, go out of your circle and expand your human experience. That would be great. And then when it comes to finding information, be intentional about looking for the positive or solid factual information. Um, and then when it hits, just say ouch and learn, and be willing to change, but keep an open mind. That's how I've challenged myself, and it's been great. It's been a great learning experience.
A lot of times when something gets heated online, and everybody, whether it's Christianity or any religion or not religious based at all, the one thing like I try to use to diffuse a situation is, and I'll say, the most basic form of any Christianity, Muslim, any religious 101 is just kindness.
Yep.
And like usually that's enough to kind of like stop people for a minute, so like because it's on social media people like to just keep going and antagonize in situations, whether it's about gender or anything, so that's what I like to put out there. 101 Christianity, 101 whatever religion, 101 kindness. Be kind to people. So
Yeah, thank you for sharing, and speedy recovery for your daughter in the hospital. So thanks for joining us during this time. I think that's great. I love that, expand your human experience, and really be that intentionality about it. I agree there is a lot of stuff out there that shapes our way, but I also think if you're intentional and you go out and seek it, there is some great stuff out there, and some people that share and are so vulnerable on social media, whether it's around disability, whether it's around things even such as weight and working out, right? Like I even realized some of my own biases around like what is fit, what is not fit, and some of my own self-talk to myself
Right.
until I started following some people on Instagram that were out there doing marathons. And again, if you had that picture in your head of like who does marathons and who doesn't do marathons, right? And they really are out there challenging those social norms. And again, I think if you're intentional about all of that, it's great. So I'm going to give my panelists like a minute or two to kind of wrap up, and then I'll share their contact information for anybody who wants to see it again. But yeah, so Amanda, did you have any closing remarks that you wanted to leave with everyone?
Basically, I know that this is about genetic bias, but in anything when it comes to our children, that's my biggest point, is just to, if we don't advocate for them, and we have to fight tooth and nail to advocate for them in every form, nobody else is going to. So I always recommend to people, seek out whatever support you can get to help you to do so. That's really all I can leave anybody with. I've experienced it, with my children, and my son was, like I said, he was 20 years old when he got properly diagnosed. So due to a lot of genetic bias.
Yeah, I just want to sort of touch on the irony of a single story. It's so dangerous and it's so powerful. Many of you may have seen, I forget the author's name. I believe she's a Nigerian author, and she has a TED Talk or a YouTube clip about the danger of a single story. When we take one person's example and assume that represents the whole group, that's dangerous. But at the same time, when we're working with an individual, getting to know their single story is so powerful. And so we have to balance that. And like Miss Sydney said, I couldn't say it any better. You have to be intentional about that work in yourself and that work within your little sphere of influence so that we can create ripples in our systems.
Thank you both for being here, for sharing, for all of that. Again, and thank you all for being part of this webinar, joining us. Here is Louise and Amanda's contact information. And then I will just give that half a second because I also want to share, we do have a post-webinar evaluation. Again, I mentioned that this is HRSA supported work, so we always love to show how we're doing on this kind of things. I know Bailey put that in the chat as well. And feel free to please fill that out. So any comments, and again, thank you all for joining us. If you have anything, you're welcome to always reach out. And if you didn't catch Louise or Amanda's contact information, you certainly can respond to us here at Expecting Health, and we'll be happy to connect you. So thank you both again very much for coming, for your vulnerability on this, and having this great discussion today.
Thank you for having me.
Thank you, everyone.